Hello and welcome to our channel. In this video we will discuss about physiology of lungs, and the topics which we will cover in this video are: what is the mechanism of breathing, what is inspiration and what is expiration, what is Boyle's law. Then we will talk about the gas exchange, and in gas exchange we will discuss about the physics of the gas diffusion. Then we will talk about the diffusion of the gases through gases, and after that we will discuss about the diffusion of the gases through liquids. And then we will discuss about the Fick's law, and then we will talk about the diffusion of the oxygen, and diffusion of carbon dioxide also. And after that we'll discuss about what are the diffusion barriers and what are the factors that affects the rate of the diffusion. And at last we'll discuss about emphysema. We'll talk about the clinical relevance. So these are the main topics, these are the basic topics which we will cover in this video. So let's start our today's topic, that is lungs physiology. Right? So the space between the outer surface of the lungs and the inner thoracic wall is known as the pleural space, and this is usually filled with a pleural fluid, forming a seal which holds the lungs against the thoracic wall by the force of surface tension. This seal ensures that when the thoracic cavity expands or reduces, the lungs undergoes expansion or reduction in size accordingly. During breathing, the contractions and the relaxation of the muscles acts to change the volume of the thoracic cavity, and as the thoracic cavity and the lungs moves together, this changes the volume of the lungs and in turn changes the pressure inside the lungs. The process of inspiration, that is breathing in, and expiration, that is breathing out, they are very vital for providing oxygen to the tissues and removing carbon dioxide from the body. Inspiration occurs via active contractions of the muscles such as diaphragm, and whereas expiration tends to be passive unless it is forced. Now next we will talk about the mechanism of the breathing, which is a very basic topic of this video. So let's talk about it. So first of all we'll talk about the process of inspiration in an elaborated manner. So let's talk about inspiration. So inspiration is a phase of ventilation in which air enters into your lungs. It is initiated by the contractions of the respiratory muscles, that is diaphragm and external intercostal muscles. First of all we'll talk about the diaphragm. So diaphragm flattens and extended the superior and the inferior dimension of the thoracic cavity. Then external intercostal muscles, they elevates the ribs and sternum and extending the anterior and the posterior dimensions of the thoracic cavity. The action of the inspiratory muscles results in an increase in the volume of the thoracic cavity, and as the lungs are held against the inner thoracic wall by a pleural seal, they also undergoes an increase in volume. And as per Boyle's law, an increase in lungs volume results in decrease in the pressure within the lungs. And the pressure of the environment, which is external to the lungs, is now greater than the environment within the lungs, meaning air moves. So this was all about the process of inspiration, and now next we'll talk about the process of expiration, means breathing out. So let's talk about in an elaborated manner the process of passive expiration. So what is expiration? So expiration is a phase of ventilation in which air is expelled from the lungs, and it is initiated by the relaxation of the inspiratory muscles, that is diaphragm and external intercostal muscles. Diaphragm relaxes to return to its resting position, reducing the superior and the inferior dimension of the thoracic cavity. And external intercostal muscles relax to depress the ribs and sternum, reducing the anterior and the posterior dimensions of the thoracic cavity. The relaxations of the respiratory muscles results in a decrease in the volume of the thoracic cavity, and the elastic recoil of the previously expanded lungs tissue, very basic law of mechanism of breathing, that is Boyle's law. Now let's talk about it. So this is a very basic point here. So as per Boyle's law, a decrease in the lungs volume results in an increase in the pressure within the lungs. The pressure inside the lungs is now greater than in the external environment, meaning air moves out of the lungs and down the pressure gradient. According to Boyle's law, it states that the volume of the gas is inversely proportional to the pressure, that is, when temperature is constant. Therefore, when the volume of the thoracic cavity increases, the volume of the lungs also increases and the pressure within the lungs decreases. And on the other hand, when the volume of the thoracic cavity decreases, the volume of the lungs also decreases and the pressure within the lungs increases rapidly. So this was all about Boyle's law, and we have discussed about the mechanism of breathing. Now next we'll talk about the gaseous exchange. Gas exchange is a process by which oxygen and the carbon dioxide move between the bloodstream and the lungs. This is primary function of the respiratory system and is essential for ensuring a constant supply of oxygen to tissues, and as well as removing carbon dioxide to prevent its accumulation. Now first of all, we'll talk about the physics of gas diffusion. That is, P is equal to nRT upon B. So let's talk about it. So the movements of the gases in a contained space, in this case here we are talking about the lungs, is random. But overall diffusion results in movement from areas of the high concentration to those of the low concentration. The rate of diffusion of a gas is primarily affected by concentration gradient. That is, the greater the gradient, the faster the rate. Second, surface area of diffusion. The greater the surface area, the faster the rate. And the third one is length of the diffusion pathway. The greater the length of the pathway, the slower will be the rate of the diffusion of the gases. Here the collision of the molecules of gas with the sides of the container results in pressure. And this is defined by the ideal gas law, which is given here in a form of an equation, as we have already talked about it, that is P is equal to nRT upon B. Now next we'll talk about the diffusion of the gases through gases. So when gases are diffusing through other gases, such as in alveoli of the lungs, the rate of diffusion can also be defined by the Graham's law of diffusion of gases. According to that, it states that the rate of diffusion is inversely proportional to the square root of its molar mass at identical pressure and temperature. In other words, you can say the smaller the mass of a gas, the more rapidly it will diffuse. So this was all about the diffusion of the gases through gases. Now, diffusion of the gases through liquids. So let's talk about it. So when the gases are diffusing through liquids, for example, across the alveolar membrane of the lungs and into capillary blood, the solubility of the gases is important. The more soluble a gas is, the faster it will diffuse. And the solubility of a gas is defined by Henry's law, which states that the amount of dissolving gas in a liquid is proportional to its partial pressure above the liquid. If we assume that the condition of temperature and the pressure for all the gases remain fixed, as they roughly do in the alveoli of the lungs, then it is the inherent differences between different gases that determine their solubility. Carbon dioxide is inherently more soluble than oxygen, and thus diffuses much faster than oxygen into liquid. So this was all about the diffusion of the gases through liquid. Now next we'll talk about the Fick's law. Very important law in case of liquids. So let's talk about the Fick's law. So Fick's law gives us a number of factors that affects the rate of diffusion of gas through liquid. The partial pressure difference across the diffusion barrier. Secondly, the solubility of the gas. Third, the cross-sectional area of the fluid. Fourth, the distance molecules need to diffuse. And the next, the molecular weight of a gas. And the last one is the temperature of the fluid. Not important with the lungs and can be assumed to be 37 degrees Celsius. In the lungs, whilst oxygen is smaller than the carbon dioxide, the difference in solubility means that carbon dioxide diffuses roughly 20 times faster than oxygen. The difference between the rate of diffusion of the individual molecule is compensated by the large difference in partial pressure of oxygen and creating a larger diffusion gradient than that of carbon dioxide. However, this means that in disease state, which impair the ability of the lungs to adequately ventilate with oxygen, oxygen exchange is often compromised before that of carbon dioxide. So this was all about the Fick's law. Now next we'll talk about the diffusion of the oxygen. So let's talk about it. Diffusion of oxygen. The partial pressure of oxygen is low in the alveoli of the lungs as compared to the external environment. This is due to the continuous diffusion of the oxygen across the alveolar membrane of the lungs and the diluting effect of the carbon dioxide which is entering the alveoli to leave the body. Despite this, the partial pressure is still higher in the alveoli of the lungs than the capillaries, which resulting in a net diffusion into the blood. Once it has diffused across the alveolar and capillary membranes, it combines with hemoglobin and this forms oxyhemoglobin, which transports the oxygen to respiring blood spent up to half the normal time, that is 1 second at rest in the pulmonary capillaries due to the increase in cardiac output, moving blood around the body more quickly. However, diffusion of oxygen is complete within half a second of the blood cells arriving in the capillary, which means that exercise is not limited by the gas exchange. So this was all about the diffusion of the oxygen. Now we'll talk about the diffusion of carbon dioxide. So let's talk about this in an elaborated manner. So the partial pressure of carbon dioxide in the capillaries is much higher than that in the alveoli of the lungs. This means that net diffusion occurs in the alveoli from capillaries. The carbon dioxide can be exhaled as the partial pressure in the alveoli is also higher than the partial pressure in the external environment. Carbon dioxide is transported in the blood in multiple ways, including dissolved, associated with the proteins, and as biocarbonate ions. Here we have talked about oxygen and carbon dioxide diffusion. Now next we'll talk about what are the diffusion barriers that create a hurdle in the transport. So, the diffusion barriers in the lungs consist of the following layers. First, alveolar epithelium, second, tissue fluid, third, capillary endothelium, and the fourth one is plasma. And next is red cell, the diffusion barriers. Now next we'll talk about what are the factors which are affecting the rate of diffusion. So there are many properties which can affect the rate of diffusion in the lungs. And the main factors include, first, membrane thickness. The inner the membrane, the faster the rate of diffusion. The diffusion barrier in the lungs is extremely thin. However, some conditions cause thickening of the barrier, thereby impairing diffusion. And the examples include fluid in the interstitial space, which is also called as pulmonary edema, and the thickening of the alveolar membranes, which is also called as pulmonary fibrosis. Now the second factor, let's talk about it. Membrane surface area. The larger the surface area, the faster the rate of diffusion. The lungs normally have a very large surface area for gaseous exchange due to the alveoli. Disease such as emphysema leads to the destruction of the alveolar architecture, leading to the formation of large air-filled spaces known as bullae. This reduces the surface area available and slows the rate of gas exchange. Now the third factor which affects the rate of diffusion is pressure difference across the membrane. And next is diffusion coefficient of the gases. So these are the main factors which affects the rate of diffusion. Now next we'll talk about the clinical relevance. So here we'll talk about what is emphysema. So emphysema is a chronic and a progressive disease that results in the destruction of alveoli in the lungs. This results in a greatly reduced surface area for gas exchange in the lungs, which typically leads to hypoxia, means deficiency of oxygen. And the main symptoms is of emphysema is shortness of breath, which is also called as dyspnea. However, patient may also experience wheezing, a persistent cough, or the chest tightness. Emphysema, alongside chronic bronchitis, are the conditions that make up common causes. And other risk factors include exposure to secondhand smoke, exposure to occupational fumes or dust, and living in areas with a high level of pollution. So this was all about emphysema. So that's all. In this video, we have discussed about the lung physiology, and we have discussed about the gas exchange, we have discussed about the mechanism of breathing, and we have discussed various laws which are implemented here in diffusion of gases, in exchange of breathing, in the breathing mechanism. And we have also discussed about what are the factors that affect the rate of diffusion. And at last we have discussed about emphysema, that what is emphysema and what are the main symptoms which leads to emphysema. So that's all. That's all for today. See you guys in our next video. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below, and yes, press the bell icon for more updates. And stay safe, stay healthy, and stay tension free. And don't forget to meditate and exercise daily. And yes, thanks for watching our video.